I have two further questions for you. Let me just, sorry. You started talking about genetics, and I don't think that there is enough focus on this these days. Of course, there are genetic testings, and people have used companies like 23andMe and so on, but I do believe that there is something that where we need to look further into this and our predisposition according to our genetics. I mean, when we go to a normal doctor visit, they ask you like some basic questions, right? Anyone in your family has had cancer? What type of cancer? But that's like very, in a way, it stays in a superficial layer, right? So how do we go deeper? And Dr. Shahnoz, how do you go deeper into genetics, and how do you apply it to your practice?
Yeah, so genetics, you can break down the genes for many groups, different groups, and then use them accordingly, right? So let's say we have 25,000 genes in our body, and a specific group of genes are responsible for, let's say, work of your nervous system and your adrenals, for example. Another group is responsible for methylation process. Another group is responsible for, let's say, glutathione processing and glutathione synthesis, right? So, and then there's another group that is responsible if it gets mutated and activated or deactivated, depends on the gene, then specifically responsible for specific diseases. My theory is it's not the disease that we have to focus on, it's what process takes place in the cell during that mutation. Because disease is the end result. How come we have BRCA test positive patients high risk for not just ovarian, but breast, and also, even if you remove breast and ovaries, they still may develop peritoneal cancer. Like there's something going on with that gene. So it's disease is just the end result. What is happening in the cell when that particular gene gets activated? When it's mutated and gets activated, what happens? Another question also, why is that patients with BRCA, 80% of them are at risk of getting disease. And there's a 20% they not. What makes that 20% not to develop that disease? It's a process. It's a process that happens in the cell.
Right.
So we're looking in the wrong direction. That's my opinion.
So we're going to be talking about this on the 18th of June in New York City, because this is something that most people are not even aware of. And they might think about genetic testing when they want to have a baby and they go to do IVF. But we need to have this in mind for every phase of our life. So again, we can focus on prevention rather than cure.